Good morning to everyone. So for today's presentation, I will discuss to you the field of nursing I have choose, which is the labor and delivery nurse, or also called as perinatal nurse. So I have choose this because simply I love providing care to pregnant women and also providing care to neonates. So here are the duties and responsibilities of the labor and delivery nurse. So first, monitor the baby's heart rate and monitors the mother's blood pressure. Next, identify and assist with complications. Help administer medication and epidurals. Next, aid in inducing labor. Prepare new mother before and after the pregnancy. And comforting a mother through painful contraction. Taking care of a new mother who have to stay in the hospital after birth. Teaching new mother about child care. Assist in emergency treatment for mother and newborns, assisting a doctor during the birth of a child, providing a comfortable environment for newborn and new mother, and keeping parents informed about health of their children. So, these duties and responsibilities are need to be met or kailangan nating magawa lahat para makamit natin ang ating goal, which is to ensure the best possible outcome for the mother and the newborn. So, makakamit natin ito sa tulong ng iba't ibang mga healthcare providers. Kaya may tinatawag tayong collaboration. So, alamin natin ngayon kung ano nga ba itong collaboration na tinatawag at kung sino-sino ang mga healthcare providers na mga kasama dito. So, the word collaboration is derived from the Latin word co and laborate, which means work together or simply means pagtutulungan or having unity. So, in this image, you can see that collaboration is also a teamwork, providing assistance, providing support, sharing what you have, exchanging of informations, providing trust and be an inspiration, and through that you can attain success. So as you can see in this slide, the image in the center represents me as a labor and delivery nurse, and the surrounding images are those persons or healthcare providers that I will collaborate with for me to attain my goals. So isa-isahin po natin sila. So first is the patient and the significant other. So through collaboration or pakikipagtulungan, nakakabuild tayo ng trust and rapport na siyang key natin upang magkaroon tayo ng proper assessment and ma-encourage natin ang mga patient and significant others to participate in the treatment process. Next is obstetrician. So the obstetrician help us in managing more complex aspect of pregnancy. And also, natutulungan nila tayo if yung patient and baby natin is need extra medical checks or care and in dealing with birthing problems or emergencies such as emergency cesareans. Next is the doctors or OB doctors. So, we collaborate with them because they help us in the delivery and also in pain control, in ordering medications or medication order, in providing anesthesia, and also in vaginal examinations. Next is anesthetists or anesthesiologists. So we collaborate with them because they help us in administration of anesthesia. And anesthesia is very important in delivery, especially if the case is emergency cesarean delivery. Next is the nurses or maternity nurses. So first is the labor and delivery nurse. So we discussed a while ago the duties and responsibilities. So next is the scrub nurse. So we collaborate with the scrub nurse because they help us in setting up the operating room. They assist us in the surgery and they help us in moving the mother to the recovery room after the delivery. Next is the circulating nurse. So we collaborate with them because they assist us in the operating room outside the sterile area and they manage the necessary care inside the OR. Next is the charge nurse, the chief nurse officer, and the chief nurse executive. So, we collaborate with them because they making sure that the nursing care is delivered safely and that all patients on the unit are receiving safe and appropriate care. And lastly is the registered nurse. So, we collaborate with them because they assist us in providing patient care. So, next is midwives. So, marami sa atin, nakala natin ang midwives is same sa nurses because they both provide care for women who are pregnant attend deliveries, and provide support, and both have opportunity to provide education on newborn. Pero may pagkakaiba sila. So we collaborate with midwives because a midwife provide care for women during their labor and throughout their pregnancy, while labor and delivery nurse do not take care of women throughout their delivery, and labor and delivery nurse do not provide care to women who are not pregnant, while midwives provide care for women during all stages of their life, not just pregnancy. Next is the nurse aide. So we collaborate with them because they help us in providing basic patient care under direction of nursing staff or under our directions. Next is the medical specialist. So we collaborate with the medical specialist to treat specific diseases of our patient. So these are the medical specialists, the family practitioner. So we collaborate with them because they provide care for people with low-risk pregnancies. Next is the obstetrician or gynecologist because they help us in providing care for the entire range of pregnancies from uncomplicated, low-risk deliveries to many of high-risk deliveries. Next is the maternal and fetal medicine specialist. So we collaborate with them because they help us in providing specialized care for pregnant and their fetuses. Next is the NICU nurse or the neonatal intensive care unit nurses. So we collaborate with them because they help us in providing primary, acute, chronic, and critical care to neonates or newborns with variety of medical ailments. Next is the nutritionist. So we collaborate with the nutritionist or dietitian because they help us in providing teachings or advices on matters of food and nutrition and their impacts on health. Next is the surgical team. So consisting of the surgeon, the first assistant, operating nurse, and the residents. So we collaborate with them especially if our patient is in cesarean section or in emergency cesarean delivery and if there is pregnancy or delivery complications. Next is the sonographer. So we collaborate with the sonographer for us to have a fetal ultrasound. So this fetal ultrasound will show us the image of the fetus and the uterus, will provide us informations about the baby's growth and developments, the gender, the abnormalities, and also it monitors the pregnancy. Next is the pharmacist. So we collaborate with the pharmacist because they help us to ensure the quality of medicine supplied to patients, and also they help us to ensure that medicines prescribed are suitable, and also they help us in advising patients about medicines. Next is the social workers or the medical social workers. So we collaborate with them because they help us in providing support that help the patient and families address the impact of illness and treatment. And also they help us in providing assessment and appropriate intervention to aid the patient in achieving optimum recovery or rehabilitation and quality of life. So these are the social workers that provide emotional and physical support to the patients. Next is the students who affiliates in the hospital. So, pwedeng mga student nurse, medical nurse na mayroong related learning experiences or duties sa hospital. So, we collaborate with them because they help us in providing basic care to our patients and sometimes critical care with the assistance or supervision of their clinical instructors. Next is the cleaning team or the hospital cleaning team and other non-professional workers. So kahit non-professional sila is kailangan pa rin nating makipag-collaborate or makipagtulungan because they help us in making sure that the hospital or the delivery room is clean, and they help us in securing the premises and the personnels, and they help in inspecting buildings and equipments to ensure that everyone is safe in the hospital. Next is hospital administrators. So we collaborate with the hospital administrators because they help us in attaining our goal in providing quality nursing care to our patients by creating and maintaining a good policies. Next is by organizing and overseeing the health service and daily activities of a hospital or healthcare facilities, and by helping in developing procedures for medical treatments, quality patient service, and public relations activities. Next is the linkages. So we have WHO, DOH, LGU, DOLE, government officials, higher hospitals, and others. So we collaborate with them because they help us in information dissemination, they help us in providing trainings and seminars, they help us when we have salary issues, they help us when we have referrals for patients, and they help us when it comes to addressing clinical issues. So as a labor and delivery nurse, I will collaborate with all these healthcare providers and personnel to attain my goal in ensuring the best possible outcome for the mother and the newborn in the delivery room. And that's all. Thank you for listening.